Tonight's Medical Journal segment brings us another meeting with Dr. Seth Bilazarian. Tonight's topic, what happens when you go to the hospital with chest pains? Let's take a look.
Hello, my name is Dr. Seth Bilazarian, and I am a cardiologist with Pentucket Medical Associates and the Merrimack Valley Hospital. I would like to talk to you today about what happens to you if you go to the hospital with chest pains. The most concerning thing about having chest pains is that physicians and patients are concerned that the chest pain may be related to a heart problem, a problem that might be related to a heart attack that could in fact be life-threatening. Anytime patients have any kind of discomfort from the upper part of their abdomen to their jaw, we're very concerned that this could be a heart-related problem. Of course, there are a variety of things that could be causing chest pain other than a heart, such as problems such as an esophagus problem or problems with the chest wall, such as the muscles or the bones of the chest wall. But the biggest concern, and the concern that is most likely to cause harm or even death to patients, is a heart-related problem or a heart attack. So when patients go to the hospital with chest pain, the evaluation is several steps to try to get the sense of whether there is in fact a heart problem causing the patient's chest pains. Of course, the history or the way the patient describes the symptoms is very important. Chest discomfort that's described as pressure or heaviness, tightness or squeezing in the central chest is more commonly related to heart-type problems. Often this pain can also go up to the jaw. Physicians call this radiation to the jaw or the shoulder. And it also may, in fact, go to the arm, either the left arm or both arms, and sometimes can go to the back. Women sometimes have pain more commonly in the back, and this sometimes makes it more difficult to evaluate women for heart-related problems because their pain is sometimes not in the chest to begin with. The second part of the evaluation that physicians will undertake is whether the patient is likely to have heart disease. Of course, an older patient is much more likely to have heart disease than a younger patient. A teenager would be very unlikely to have heart problems. A smoker would be more likely to have heart problems than a non-smoker. So there's a variety of issues that physicians will evaluate to see whether the patient is likely to have a heart-related problem, both the kind of pain, the duration of the pain, how long the patient's been having the pain. Associated symptoms such as shortness of breath and nausea are also suggestive of heart-related problems, as well as what the patient's risk factors for heart disease are, such as age, smoking, high blood pressure, diabetes or high cholesterol, or of course a prior history of heart disease, all make the physician more concerned that this is a heart-related problem. When patients come to the hospital, the emergency room physicians will evaluate the patient with both this history, a physical exam listening to the heart and lungs, and most importantly an EKG, which can be very helpful in deciding whether the patient is in fact having a heart-related problem such as a heart attack. In addition, blood testing called cardiac enzymes can be very helpful to evaluate whether the patient has had or is having a heart attack. Patient's treatment involves an oxygen as well as medications to help reduce the pain, such as medicines as morphine, an opiate-type medicine, can reduce the pain, and nitroglycerin, a medicine that helps dilate the blood vessels in the heart if the chest pain is thought to be related to the heart. Generally, patients are admitted with chest pain because of our concern that the chest pain could be heart-related. If there is more than a moderate suspicion that the chest pain is heart-related, a patient will be admitted overnight for observation. This is for several reasons. One important reason is that if the chest pain is related to a heart-related problem, the most likely chance of a problem in the first several days, or first 24 hours most importantly, is from a heart rhythm problem that can even cause sudden death. And patients are monitored either in an intensive care unit or on a medical surgical floor that has telemetry monitoring, so the patient's heart rhythm can be continuously monitored. During the initial 24 hours, patient will also have serial enzyme tests, repeated tests every 8 to 12 hours to evaluate whether there has been heart injury and a heart attack. If there has been a heart attack, this can be very convincing evidence to promote the additional evaluation with catheterization or other procedures that can more clearly define the problem with the heart. If the patient does not have any kind of enzyme abnormalities, does not have any EKG abnormalities, and does not have any additional pain after admission, generally the procedure is stress testing to evaluate whether the patient has any problems with the arteries in a non-invasive evaluation with a treadmill exercise test, such as a treadmill test that people commonly use at home or in an exercise gym, but it is done with monitoring of the heart using EKG monitoring. If that is also not problematic, if that is a normal test, then it is felt to be convincing evidence that the patient does not have any kind of heart-related problems, and patients are generally discharged after that for follow-up with their physician to discuss whether other causes for chest pain should be investigated, such as a food pipe problem like gastroesophageal reflux, or ulcer problems, or muscle or skeletal or bone-related problems, or arthritis can all be other causes of chest pain which can be evaluated over time without the same concern that we have for heart-related problems. In summary, if you do have chest pain and it lasts for more than several minutes, and certainly if it has features of tightness or heaviness, it's important to be evaluated in an accelerated way at the hospital or with your physician if he is available for evaluation. This evaluation generally involves EKG testing as well as blood testing and can be very helpful in deciding whether you have a heart attack and initiate heart attack treatment very quickly if appropriate. The topic of a separate segment of this health information topics will be on the treatment of heart attack, which will be done at another time. Thank you again. This is Seth Bilazarian from Pentucket Medical Associates and the Merrimack Valley Hospital.